Hello everyone, Джумагулова И.М from Higher Medical College, and today we are going to speak about examination of the patient. The aims of our lessons are to provide information on the importance of patient examinations, to explain the systematic and comprehensive approach to conducting examinations, to educate students and the general public about the significance of various components of a patient examination. The plan of our lesson consists of introduction, the main parts, and conclusion. So, all in all, we are going to speak about general examination, rules of general examination, techniques of examination, and symptoms of the disease. First, let's get acquainted with the new words of the text. Этиология, причины и условия возникновения болезней, патогенез, механизм развития течения индивидуальных особенностей исхода заболеваний, механизм, visual, визуальный, auscultation, аускультация, выслушивание, palpation, пальпация, ощупывание, percussion, перкуссия, постукивание, cystoscopy, цистоскопия, edema, отек, hemorrhage, кровотечение, objective – объективное, subjective – субъективное. Patient examination is a fundamental component of healthcare, providing valuable insights into an individual's overall health. General examination of patient as a diagnostic method retained its importance for the physician in any specialty, despite the increasing number of instrumental and laboratory studies. Before treating the patient, it is necessary to make a correct diagnosis of the disease and to determine its etiology, i.e. the causes of the disease. The doctor must know well the pathogenesis of any disease, i.e. the way and mechanism of its development, as well as the symptoms by which it can be revealed. A number of different procedures is used to establish a diagnosis. History taking, physical examination, which includes visual examination, palpation, percussion, auscultation, laboratory studies consisting of urine analysis, blood, sputum, and other analysis, instrumental studies, for example, taking electrocardiograms and cystoscopy, X-ray examination, and others. The order of physical assessment techniques usually occur in the following order: inspection, palpation, percussion, and auscultation. Use them in sequence unless you're performing an abdominal assessment. Palpation and percussion can alter bowel sounds, so you'd inspect, auscultate, percuss, then palpate an abdomen. The first inspection. Inspect each body system using vision, smell, and hearing to assess normal conditions and deviations. Assess for color, size, location, movement, texture, symmetry, odors, and sounds as you assess each body system. The next technique is palpation. Palpation is a process of using one's hands to examine the body, especially while perceiving or diagnosing a disease or illness, usually performed by a healthcare practitioner. It is also the process of feeling an object in or on the body to determine its size, shape, firmness, or location. On light palpation, the examiner tests for any palpable mass, rigidity, or pain. On deep palpation, the examiner is testing for an acromegaly, including enlargement of the liver and spleen. The two-handed method may be used. Begin at the right lower quadrant and examine the entire abdomen gently by deep palpation. The third technique is percussion. Percussion is a method of tapping on a surface to determine the underlying structure and is used in clinical examinations to assess the condition of the thorax and abdomen. The fourth method is auscultation. Auscultation is a term for listening to the internal sounds of the body, usually using a stethoscope. For determining a disease, it is very important to know its symptoms such as breathlessness, edema, cough, vomiting, fever, hemorrhage, headache, and others. Some of the symptoms are objective, for example, hemorrhage and vomiting, because they are determined by objective study, while others, such as headache or dizziness, are subjective since they are evident only to the patient. Before treating the patient, you need to make the correct diagnosis, i.e. know the causes of the disease. To become a good doctor, you need to know the symptoms of any disease. A number of different procedures is used to establish a diagnosis. If you want to be a good doctor, you should know all this knowledge. Here, the tasks for you. Thanks for your attention. Bye.